Imagine you experience a persistent ache in one of your bones, or perhaps you notice a new lump. It's perfectly natural for your mind to immediately jump to questions about what it could be and whether it's something serious. Doctors differentiate between a benign bone tumor and bone cancer through a careful and comprehensive process that involves several key steps. The ultimate and most definitive answer often comes from examining a tissue sample under a microscope. The core mechanism behind this differentiation lies in understanding the cellular behavior of the growth. Benign tumors, by definition, do not spread to other parts of the body, and their cells typically look and behave more like normal bone cells. Malignant tumors, or cancers, on the other hand, have cells that grow uncontrollably, can invade surrounding tissues, and have the potential to metastasize or spread to distant sites. To achieve this understanding, physicians begin with a thorough medical history and physical examination, asking about symptoms like pain, swelling, or limited movement. They then move to various imaging studies. X-rays are often the first step, revealing the general appearance of the lesion. Magnetic resonance imaging, or MRI, provides detailed images of soft tissues and bone marrow, helping to assess the tumor's size and extent. A computed tomography, or CT, scan might be used to get a more precise look at bone destruction. For example, a benign growth might show smooth, well-defined borders, while a malignant one could appear irregular and destructive. Doctors specifically look for signs of periosteal reaction, which is how the outer layer of the bone responds to growth, and whether there are signs of bone destruction or new bone formation that indicate aggressive activity. The most crucial step is usually a biopsy. This procedure involves taking a small sample of the abnormal tissue, either with a needle or through an open surgical incision. A specialized doctor called a pathologist then examines these cells under a microscope. They look for specific cellular characteristics, such as cell shape, size, how quickly they are dividing, and any abnormal cell structures. This detailed analysis allows the pathologist to classify the tumor as benign or malignant, and, if malignant, determine its specific type. Sometimes, doctors also use advanced techniques like immunohistochemistry, which uses antibodies to detect specific proteins in the cells, or genetic testing, to identify particular genetic mutations that are characteristic of certain types of bone cancer. These molecular insights provide an even more precise diagnosis and can help guide treatment options. Ultimately, this comprehensive diagnostic journey, combining a detailed patient history, advanced imaging, and meticulous tissue analysis, is what empowers doctors to accurately distinguish between a harmless bone tumor and a serious bone cancer. This precise diagnosis is the foundation for determining the right course of action and providing the most effective care for the patient.